Ever wondered how ethical guidelines shape the medical world? Well, today we're exploring how to navigate those gray areas in medicine. All that and more coming up next. Hey, Honors Schools, welcome back to the Honor Roll Podcast, the flagship podcast of the Judy Genshaft Honors College Podcast Network. I'm your host, Fabiana Requena, a fourth-year student studying marketing and business analytics here at the Honors College. And today, my very special co-host is Lily Belcher, also a fourth-year student majoring in mass communications and professional and technical communications. It's great to have you here, Lily.
Thank you so much for having me on.
Well, as always, we like to start off the podcast with one big question. So this week we're asking, do you think that ethics should be something that's taught in the classroom or something that you learn on your own outside and at home?
I definitely think it can be taught in the classroom, but I think that internships and getting experience in your field is going to shape your ethics in a lot of ways also.
I completely agree. I think you don't realize how much you can learn within a classroom setting, and there's a lot of professors that will kind of push you to ask these deeper philosophical questions. And I also think that it's something that you learn at home, right? So from your upbringing or just experiences that you have on your own time. Well, this week, we're excited to explore how ethical dilemmas influence decisions within the medical field with Dr. Victor Bowers and honors students Niveditha Chandrakanth and Vinesh Jarajapu. Stay tuned.
Thinking about joining the USF Judy Genshaft Honors College? Sign up for a tour. They're led by honors ambassadors, real students who can give you the inside perspective you won't get from a website. You'll be learning about honors courses, student life and events, mentorship opportunities, scholarships, and professional development resources. All while exploring the honors building and hearing what the experience is really like. If you're ready to see what honors at USF is all about, sign up for a tour today.
Today we are joined by Honors Affiliate Faculty Member Dr. Victor Bowers and Honors students Niveditha Chandrakanth and Vinesh Jarajapu. Welcome to the podcast. Would you like to introduce yourselves?
Thank you. Let's have the students go first.
Sure. I'm Vinesh. I'm a biomedical sciences major here at USF, and I'm on the 7-year BSMD track, so I'm aspiring to be a physician in the future.
My name's Nivi. I'm originally from Michigan. I'm majoring in biomedical sciences and doing a minor in health informatics, and I'm also on the BSMD track, so I aspire to be a physician as well.
And I'm Vic Bowers. Previously worked as an abdominal transplant surgeon at several institutions, more recently at Tampa General USF Group, and then transitioned to become the medical director full-time for LifeLink of Florida, which is an organ procurement organization.
Well, it's really nice to have you all here. Thank you so much for joining us again. I'd like to start by asking you, Dr. Bowers, what inspired you to pursue a career specifically in medicine and eventually specialize in transplant surgery?
How much time do we have? It was really a circuitous route. My parents were not very well educated. They both grew up during the Depression and both didn't finish school. And so they worked all their lives to provide for their children. And so education wasn't important to me, but I liked reading and I liked school. Had good grades in high school. And so then I got a scholarship to a small college outside of Fort Myers. The majority of my time I grew up in Pittsburgh, but then my father lost his job in the steel mills, and so we moved at that time, and he came to Florida, and that's how I got down to Fort Myers area. And then I spent a year and did well in college, but I just wasn't motivated, didn't like it, and so I dropped out. I had a scholarship, and I dropped out. People thought I was insane, and I needed my head examined, but then I started working as a mortician, and I became an embalmer, and then I went over to Miami and started working, and then I went to school at the same time, and then I realized that this isn't what I really want to do either. So then I came back to USF and got a BS in chemistry, and then sort of in the transition from the mortuary area, I was encouraged by my colleagues down there that, you need to do more than this. And I decided that they were right, and that's why I chose the BS. Initially, it was going to be just a PhD kind of person, but then I felt that I wanted to do other things. And so I applied to medical school and got in at the University of South Florida, the third class in 1976, and graduated in 1979. So that's how I got into medical school, a circuitous route. And then I was a general surgery resident and spent 5 years doing that. And then had a position in the program in Pittsburgh to do thoracic surgery fellowship. And I was all set to do that. And then some life-changing events happened. I met a gentleman by the name of Dr. John Ackerman, who was the only transplant surgeon in Tampa at the time. And he befriended me. We talked. And the side story is because he upset the Department of Surgery chairman, he wasn't allowed to work with the residents. And so, but we did it on the sly, so to speak. And he encouraged me to do more with my life than be a heart surgeon. And so that's what I decided to do. He got me a position, so that I went to England in 1985 at Cambridge University, Addenbrooke's Hospital, and spent a year over there, came back here, and then did fellowships at Ohio State. And because at that time, the whole governmental policy regulating transplantation was beginning to evolve, and the structure of it and how it was going to be put together. It was a congressional act out in 1984. So after finishing Ohio State, went to the University of Iowa and worked there for a while, and then actually went to the University of Nevada and was the director of their renal program because they didn't have one. So we started their first renal transplant program at University Medical Center in Las Vegas. And we did the first transplant on Christmas Day, 1989. So
Fascinating. I mean, you've been really all over the place.
That's what I said. It's a bit of a circuitous route for sure. And then came back to Tampa in 1991 and joined the university because at that time the departmental chair was Dr. Larry Carey, who I knew from Ohio State, and he had then came down here and was the chair of surgery, and so that's why I decided to go back with the university at the time. And then in 1994, Dr. Shires, who was the head of LifeLink Foundation at the time, decided he wanted to start a healthcare institute related just to transplant purposes and et cetera. So he recruited the physicians. It was sort of odd because we had an institute, but I was the only one in the institute for about, a year and a half. And then we gathered some other physicians, and he built the programs from brought in the appropriate people, the surgeons, the cardiologists, hepatologists, et cetera. So we helped establish all the programs here in the Tampa Bay area. And then in 2010, because of some financial situations and issues, we were absorbed by Tampa General Hospital and began employment. And then obviously we've always had a strong relationship and appointment at the university, and so we were providing that opportunity with the medical students and residents at the university. And then in April was when I decided to retire from clinical practice and devote my entire time to the procurement aspect of transplantation.
What did you like about medical school that you weren't getting when you went to college the first time before you dropped out?
I think in medical school there is more of a collegial attitude. There's more of interest and motivation to learn, and that's the other crazy thing about medicine. It's changing so rapidly. And so things you may learn in medical school may not be true 5 years later or something like that. And so that sort of is what I liked about the aspect of things. And I was going to be different kinds of physicians when I went through medical school. I was going to be first a pathologist because I was comfortable with that, being from the mortuary science world and dealing with that, medical examiners, et cetera. But then I realized that looking under microscopes gave me headaches, and I probably wouldn't want to do that on a long-term basis. So then I was going to be a primary care doctor and an internal medicine physician. Then when I had surgery, I really liked the concepts of surgery, of this immediate way that you can help people's lives. And because of that, I went into surgery, even though I didn't like most of the surgeons. But we got to know each other. And it's been the best part of my life.
Now, you're also the medical director of LifeLink of Florida,
Right.
which is a federally designated organ procurement organization. Tell us a little bit about what you're doing over there and what
Okay,
that is.
sure. Organ procurement organizations are licensed through the Health and Human Services Department and then overseen by HRSA and CMS. And so what that is that we get designated hospitals and service areas because of the Transplantation Act of 1984. In the Code of Federal Regulations, hospitals are instructed that they have to work with an OPO to identify donors, and then that our job is to then maximize the option of donation, et cetera. And so that's now what occupies my time. So therefore, it's an educational effort to all the hospitals we serve. There's like 68 in our service area. We go all the way down to Fort Myers and all the way up to Brooksville, over to towards Kissimmee in the middle part of the state. And so I outreach to all these hospitals, provide educational opportunities. Many of them have surgical residents and work with that, educate their staff, develop order sets and protocols to safely take care of the donors, et cetera, and then interface with my education at the coordinator level too. So I do a lot of talking now.
I imagine for you both as students, like, and looking towards your future careers in medicine, is this something that like interests you?
Yeah, I think for sure, like seeing Dr. Bowers talk about his like previous experiences within surgery is really inspiring because I think we both experienced times of like doing shadowing and volunteering otherwise, but being able to talk to a physician over the course of a semester is really inspiring and something that taught me a lot about like what transplant surgery could look like as a career.
Yeah, I think one of the big things that we learned is that going into medicine and being a physician is that you're dealing with patients when they're at some of the worst points of their lives. The decisions you make there are really important for their futures and their families and all that.
Now, Dr. Bowers, you teach a biomedical ethics course here at the Honors College. What kind of topics are students exploring with you in that class?
Oh, we have a wide variety of topics. I think, first of all, it's important to understand the history behind ethics and how it even came about and why was it necessary. Because medicine for the longest time was very paternalistic. In other words, you did what your doctor told you to do. And then in the 80s and 90s, that's begun to shift, and partially because of the way the medical community had treated certain groups of patients in our country. And it wasn't very nice. And so therefore, there's a shift away from that. And now I think it's something we've begun to lose the trust of patients. And I think that's the important thing of how to build that back. And so that's sort of how the course is constructed. But we talk about difficult relationships with patients and physicians, the futility of some treatments. Why would you do that? What if you get unexpected results? How do you handle that? We talk about brain death. We talk about organ donation, transplantation. We talk about abortion and assisted reproductive methodologies. We talked about CRISPR technology, stem cell implantation, and that just opens yourself up for a wide variety of ethical issues there. We talk about AI and medicine and how that's going to affect us in the future and how we can, we should use it as a tool. Then we go on to talk about some of the physician things such as burnout, depression, and how to deal with that, and how to be resilient in this profession, because even though people may have a think this is the ideal position and profession, it's fraught with a lot of challenges, if you will. And some of that comes from society, some of it because of our construct of how our healthcare is delivered. But I think there's a lot of greed in the system, and that needs to be addressed in the future. And I think it's up to these people to do that.
I think you brought up a lot of really good points, and a lot of topics that you cover in the course are things that I wouldn't even think about when you talk about biomedical ethics. It's really good for students that are looking to go into the medical field to be thinking about these things, because I feel like it's not necessarily something that you cover in your regular curriculum and your Orgo or whatever other courses you may be taking. I'm curious to know why you both decided to take the course as opposed to all the other honors courses you could take.
Well, I think it's like you say, when I saw biomedical ethics as an aspiring physician, I knew that these were some things that we'd have to come across as a physician. And I really wanted to learn what it would be like to be really in the field of medicine beyond, medical treatment and diagnoses and things like that. The decisions that doctors have to face on a day-to-day basis. I really wanted to learn about that. And alongside that, like we were talking about some of the technologies that are coming up in the future, like CRISPR, gene editing, and AI especially. I thought it was really interesting to learn about how these technologies would play a role in our future as physicians and how we can ethically kind of integrate them. Because with new technologies comes a lot of new regulations and standards.
I know you both brought up AI. I'm curious to know what specialty you think is going to be the most impacted. Like, did you talk about that within the course?
We did.
Yeah, I think like a misconception within medicine is that AI is going to take over a lot of specialties right now, but I think it's more important to look at how we can use artificial intelligence to help physicians sort of like an aid in their work, because a lot of times there are a lot of tasks that could be replaced with AI, and that just gives them more time to spend with patients. So I think more looking at it as a positive benefit for physicians is really important, because I think right now the current trend is looking at like how AI could take over a lot of specialties, but in reality, I think it's more of a helping hand for physicians right now.
That's so true. I think that kind of if you have like, let's say you have like a day to do something, like AI can cut out a lot of the work and give you more time to do like more meaningful things. Whereas a lot of people think like, oh no, like that'll just cut out my job completely, when you still need a specialist like in every field to know to go back and check. And like you said, to spend more time with the patients.
Now, Dr. Bowers, you've seen a lot of changes throughout your...
Doesn't mean I'm old or anything.
No, not at all, not at all. But you've still gotten to see a lot of changes and navigate those.
Amazing, yeah.
How are you advising students as to when they're looking at maybe a future that's unclear as to how AI or gene editing is going to play a role? How are you advising them to navigate a very different world in a couple years?
Absolutely. Well, I think to be a physician and through and get into medical school and get through it safely, you have to have a well-rounded science background, first of all. But I'm not sure you have to have 100% in everything, okay? Because we're losing the values which are very important, and which in my mind identifies physicians and separates physicians. And that's the moral compass that we all should have, wanting to do the right thing for the patient, knowing what the right thing to do for the patient is, and then how to avoid all those bumps in the road, if you will, which are going to try to disrupt your thought process and training and things like that. So I think we have to redevelop the art of medicine, and I think we're losing that, becoming impersonal and things like that.
When you were practicing, what was the biggest change that you had to navigate?
Electronic medical records was my downfall. It took me forever to do things, because I'm not fast with it, and I refused to sit in an exam room and have my back to the patient. So I would look at the patient, would examine the patient, and then later on that night or afternoon or whenever I got to it, I would do their clinic notes and from my handwritten notes. So it was very inefficient, but I felt a better connection to the patient than just looking at the computer and typing in what they were telling me so that my work could be done.
Now, in your studies, how are you preparing to navigate those changes that we're all facing now as students who are going into the workforce in a couple years?
Yeah, I think it's really important to stay up to date in terms of like what medicine is currently doing. I think that is by like reaching out to different faculty who are currently in the field and seeing those changes, and also looking at like current literature that talks about like the new trends in terms of AI and like gene editing, like we were talking about. I think it's just important to be educated about what we're going to foresee in the future within our careers.
I think the biggest thing for me is to try to just learn as much as I possibly can right now. A lot of people going into medicine, you think about the medicine side, but some of the biggest frustrations I've seen with doctors are with the innovations and technologies that are coming out. And like Dr. Bowers was saying, he wants to talk to the patient, he wants to work with the patient, but then the note taking is what's taking time. So even with AI, actually, I think a lot of the innovations are leaning towards taking away the things that doctors don't want to do, so they can focus more on the patients. So I think trying to learn as much as I can, whether it's computer science, innovation, or medicine, I think it'll help in the future.
How is a course like this one, Biomedical Ethics, helping you figure out what pieces AI can replace maybe, or some of these future technologies? How does this course help you figure out what the role of the future is in your work?
Going into this class, I thought AI would have a much bigger role than I do now. But from our conversations and discussions, I kind of realized that at the end of the day, there is no replacing a physician and the patient-physician connection that's there. So I think AI will have a great role in, automating the kind of boring, repetitive work that a physician wants to stay away from. That because that's not the reason they really got into medicine. But I don't think AI will ever be able to replace that patient-physician connection.
Yeah, and I think, like you were saying, it's really important to be able to remember that in any situation that we talked about in terms of ethics, there isn't one situation where the physician is not there explaining the current status to the patient. And that is something that can't be replaced by AI, and understanding how we can effectively communicate the new trends to not only our peers in medicine, but also to the patients is really important, because I think a lot of times there's this wall that exists between the patients and their physicians. But if you're able to understand the science behind things very well, I think you'll be able to develop the skill to explain to patients as well.
Right. You really need that specialist there to help out. Now, Dr. Bowers, going back a little bit, I wanted to go back to the way in which you were discussing kind of the language you use around the art of medicine. It sounds very philosophical, and you need to know a lot of kind of psychology behind all of this to help these moral, ethical dilemmas, right?
Absolutely. I think the psychology and understanding of that and communicating is something that is in danger, because we tend to focus on the CT scan or this, and rather than knowing what the patient is and what's the best thing for that patient, knowing these problems that he or she may have. And so that's why it's critical to have this relationship. And that, to me, is the art of medicine, because, you could be a great surgeon, but you can be even better if you take care of the patient and not just the disease.
Yes. You need that kind of humanitarian aspect.
Right, absolutely. And I think because of our society, we seem to be drifting away from that. And hopefully the groups of people that's in front of us here can change that. I know they can.
I love that point made, because I think it really shows that ethics doesn't really have a right answer, no matter what situation we address.
Yeah.
And, it came up a lot of times in class. We'd talk about a specific person or situation, and we'd kind of, as a class, figure out what we would do.
Yeah.
But then if you change one small aspect of that patient, maybe their background, maybe their family history, something like that, your answer completely changes. So I think with ethics, it's really important to not just know the right answer, but know how to get to that answer, to try to have the best answer in whatever situation comes up.
Right. Every individual case kind of opens up its whole world, and manipulating those different variables can change the whole equation, like you're saying.
Yeah, and I think that the ethical components of any decision-making process is what gives the physician his or her identity, because it's the virtues, it's the moral compass, it's doing logistics things, it's doing an evaluation, it's communicating with the patient, it's arriving at a just decision not only for the patient but maybe for society too. And we have to think globally sometimes in what is something that's going to be bigger than us.
Yeah.
So. Now, I'm not a medical student,
Okay.
and I know a lot of people in the honors college aren't pursuing that career. Why should I take your class anyway?
Well, I think it would be a good example to expose whatever field that you may be going into or into now, is that you will be touched by these subjects in some way or another, maybe not next year, but maybe 5 years from now. And it's going to give you an understanding and the complexity of which they are. And I think would make you a better person if you would want to do that. It's kind of boring if you're not thinking about medicine, because that's all we talk about, but still it would be some way to, I try to teach the class so that even if you didn't have any background, because these young people are out there working in labs and being exposed to medicine in different ways. But even if you weren't doing that, I try to pick articles and discuss things in class so that we can discuss this if you're in finance or business or whatever, that you would still understand that, because it's not so much about understanding the medical and the technical aspects, it's understanding the philosophical aspects of how this patient should be treated, using the 4 pillars of ethical discussion to arrive at that decision. So I think it would be beneficial.
Yeah, it really sounds like you can apply those to really any field because
Right.
in anything that you face, you will likely have to to consider those things.
Yeah, it's figuring out how to make those tough decisions.
Yeah,
I
I would sign
completely
up.
agree. And I think healthcare is unfortunately one of those things that no matter what field you go into, you'll probably have to encounter in some way.
Absolutely.
If not from the medicine side, then from the patient side,
Mhm.
whether it's you or a family member. So understanding these ethical situations and thinking about them beforehand, I think is essential for everyone.
Yeah, and I think the reality of medicine is that it's very interdisciplinary. So even if you're not a physician, even if you're in business, you're in computer science or communications, I think there is some sort of standpoint where you can get a career within the field of healthcare, even if you're not seeing patients every day. So I think it's important to be knowledgeable about like the ethical dilemmas that physicians have to deal with.
Yeah, absolutely. Now, I'm curious to know what your biggest takeaways from the course were.
Yeah, I think for me, my biggest takeaway is that just the reality that things are never black and white. And there were so many times that when we came up with a decision, we'd have people who had different standpoints. But I think growing up, I think in high school especially, I didn't really talk to people who maybe had a different opinion. But coming to this class, I had to hear like different opinions that maybe I didn't always agree with. But having those discussions with Dr. Bowers facilitating them, I think that really helped me understand to hear out different perspectives. And now as a future physician, like going into the career, like field of medicine, I think it'll be really important to hear out other people's perspectives there.
I think it kind of changed my definition of what a physician is and the kind of physician I want to be in my future. So going into it, I thought the best physician would be the one who can diagnose the best, treat the best, be the most accurate. But, especially with all these new technologies coming out that are kind of automating this process, I've realized that the best physician is the one that can be there the best for their patient, can understand their patient the best, even if they come from different cultural backgrounds, and can make the correct decisions, even if they might not always be correct, but who can guide themselves correctly on that path to make the decision. I think that would make the best physician.
Dr. Bowers, in addition to teaching at the Honors College, you're also an associate clinical professor of surgery at USF's Morsani College of Medicine. What do you enjoy about teaching for both of your students?
Well, with the accent, like for example, when I present a trauma conference or grand rounds for the Department of Surgery, et cetera, we focus on the whole concept of transplantation, emphasizing the importance of organ donation because the only way we can get transplants accomplished and people's lives saved is to use these organs in that fashion and then give them another gift so that they can lead a more productive life. So that's how I interact mostly now with the students, both in the medical school and residency at USF.
Do you see them as very different, or would you say that there are more similarities between the two types of students?
I think they're overall similar because we have a very select group of individuals here, and they're very motivated, and that's what you're going to see in medical school. And the key is developing a resilience through those medical school years and your residency education so that you can be productive. Don't get all the things as far as moral injuries and these emotional things which may tear at you, but you may not even understand what's happening. I think it's very, very important to be able to talk to people about that. I think it's very important to be able then to adapt to your situations and how and why are you being felt that you're being, compromised in any way. And I think giving you an understanding like that is going to give us an opportunity to be even bigger and better. And again, I think that this is going to help tremendously with not only creating a workforce which has a moral compass from a healthcare standpoint, but also in building a physician relationships with their patients, which I think needs improved.
Absolutely. Now, Nivi and Vinesh, how do you think this course has helped you prepare you for your future career in healthcare?
Yeah, I think for me, I think this course definitely showed me how things can get tricky, especially with difficult topics. But at the end of the day, all providers, like their first goal is to help the patient. So I think despite any differences that we do have, we can come to that like moral compass that hopefully all physicians do have when we get to those difficult situations, that we can come back and see how can we make sure that as a physician, we're making sure the patient their rights are there and also the families as well.
Yeah, it kind of put me in the shoes of being a physician. It showed me what it would be like and some of the difficult decisions they can make. And it showed me that, even if you follow all the right steps, you could still make the wrong decision. And I think that's one of the tough parts about medicine. And I did really enjoy the course. It taught a lot about, being a physician, but also like the future of medicine and how we should approach that as physicians.
I'm glad you both had such a positive experience, and it seems like Dr. Bowers had a really positive impact on you. Finally, with what advice you could give to other honor students, maybe prospective honor students, or just people looking to take the course, what would you say to them if they're, considering this over another course?
I would say come as curious as you possibly can. We had our time in class, but a lot of the things I learned was actually just talking to Dr. Bowers after class, learning from his experiences. And, looking at one ethical situation, there's so many different questions that come up. And I think coming into this class ready to look at all of that really lets you get the most out of it.
Well, it's been a pleasure to have you all here. Thank you so much for joining us.
Thank you.
Thank you.
Thank you.
Thanks for joining us back in the studio. What did you think about the podcast?
I absolutely enjoyed today's podcast so much. I really liked sitting down with Dr. Bowers, who has so much experience from all the different places that he's trained at or has experience at, and now finally settling here at USF. I would have never thought that a course in ethics in medicine would be so important, but I really enjoyed sitting down with the students and getting to see their perspective and see how it's going to shape their future as physicians.
I agree. It was a really great opportunity to hear different perspectives and real-world examples. And I also liked how the students were more engaged with ethical conversations by the end of the class as opposed to when they came in. And with that said, don't forget to check out the Honor Roll newsletter and our website, usf.edu/honors, for upcoming events, updates, and news.
That'll do it for this week's episode. The Honor Roll podcast is recorded in the Judy Genshaft Honors College at the University of South Florida Tampa campus.
Production assistance is provided by USF students Sandra Napolitano, Vama Shah, Nicholas Henry, and Maya Nikolsky.
Thank you all so much for listening, and please do not forget to rate and review our podcast, as we really appreciate your feedback. Please join us next week to hear more honor stories and talk to more members of the Judy Genshaft Honors College.
Until next time, go Wolves!